Now, the first thing is you shouldn't be scared to go for the check because you think that they might discover something.
Yeah.
It's a good thing for them to discover something early.
Early, yeah.
You know, you cannot put your head in the sand and wish it away, especially if it's something that is insidious, something dangerous. It's something that will progress. So when we talk about cancer, the emphasis for us is that if a patient comes with it, we hope that they come in early enough so that we're able to catch cancer at an early stage.
Yes.
And if we are able to do that, we might be able to manage and achieve what is known as cure, right? Cure cancer, as it were. That means just eliminate the disease process. And once we've eliminated the disease process, we can follow you up and see that there's no return of the disease process. And that means you can continue living a normal life. Now, the problem is that if people are scared, some people might be scared, they have a lesion in the mouth like an ulcer. They don't want to be seen by the dentist. They might actually self-prescribe medications, thinking that it's an infection and hoping that it will go away. But the longer you stay at home, the worse it is. The cancer is not waiting.
Yes.
It's going to
Hello guys, Dr. Kendi and Dr. Kamau here again. We're back to proceed with part 2 of oral cancer awareness. Remember we did part 1 last week, so if you haven't watched part 1, please make sure you do, because this honestly is just a conversation. We are picking up from where we left literally last time. Anyways guys, welcome back to my oral health diaries, and let's continue with the discussion. Again, welcome back.
Thank you.
Dr. Kamau.
Thank you very much.
Super honored to have this doctor with us, such a wonderful doctor. Okay, so as we've told our viewers, we are going to just pick up where we left off because we did not finish our conversation. Clearly, oral cancer has a lot to talk about. Yeah, so maybe on this episode we are going to start with last time we discussed risk factors. So there's a lot of awareness this month in April with regards to oral cancer and screening.
Yes.
Yeah. So maybe we can tell our viewers what oral cancer screening entails. What does that entail?
Okay, oral cancer screening means that the way you look at it, it can be self-screening, so it's for you to actually check and just see. If you feel that there's something that you're not sure about, you can actually just do it in front of a mirror just to check. That's if you note something. Right? Or if not, and you just want to have a look, I mean, you can still check when you're brushing your teeth. The second part of screening is now the professional screening, where you actually go to a clinician and they have an assessment. So clinicians can be varied. They can be from primary healthcare, the nurses, or clinical officers, medical doctors, etc., dentist to the maxillofacial surgeon. So that's professional screening. So when the screen for oral cancer screening, like this month would be a good time for you, for in general the population or whoever you are, just go and have a check. For me, I would suggest that if you feel that you have an issue, a lesion in the mouth, a swelling, an ulcer that has gone beyond 2 weeks in duration, it would be imperative for you to go and have an assessment, a clinical assessment from a qualified doctor, preferably somebody who deals with the oral cavity all the time. It would be a dentist or maxillofacial surgeon. Right? That would be
just the basics.
Just the basics.
Yeah.
The idea being to find out what is the problem and then to give you a solution to that problem. Because something that has gone for 2 weeks means it's not really kind of, let's say, going away kind of thing. So that is what I would say. If there are no issues, I think we should not just continue with life and forget about just checking our own health systems.
Yes.
Every year would be important for you to not only have a medical checkup, just in general, just go to the doctor, just have a checkup.
Yeah.
How are you feeling? Generally, etc. You don't need to go through a battery of tests, just to have an assessment. Quick Q&As, question and answers. The same should be done for dental. You should also go visit your dentist just to have a dental checkup. It's good for you to be assessed your teeth, but whenever they're looking at teeth, they're also looking at the tissues around that.
Yeah.
If they notice something that you might not have noticed, they'll be quick to pick it up. The suggestion probably would be to do it once a year. And that's the screening that I think we should put into our minds, that even if you feel well, every year, make it a point, once a year, just one day, go see a medic and go see a dentist.
Yeah.
It will save you a lot of issues, if there are any, moving forward.
Yes. Thank you, Dr. Kamau. You
Yes.
know, we have been screaming on my oral health diaries and shouting, checkup, 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 until my patients have actually started telling me, Dr. Riani, you've shoved it down our throats that we have to do checkup. But it's important because it honestly breaks our heart when you've been there, you've been sick, you've just been at home. But this thing, we could have caught it earlier and we could have saved you from all the trouble. So it's not like we enjoy having patients who are really suffering. We would like to get these things as early as possible. So during your annual checkup, as we encouraged you guys, your dentist will also be screening you for oral cancer. There are things that we look at. We look at your gums, we look at your cheek, your neck region and the nodes and everything. So that is definitely something to put in your diary every year, to have a checkup. Many patients are scared that, if I come for screening, what if there's something wrong? What if if your doctor notices there's something here that looks a bit insidious, as you said last time, what would be the next step? Something is looking suspicious.
That's a very good question. Now, the first thing is you shouldn't be scared to go for the check because you think that they might discover something.
Yeah.
It's a good thing for them to discover something early.
Early, yeah.
You cannot put your head in the sand and wish it away, especially if it's something that is insidious, something dangerous. It's something that will progress. So when we talk about cancer, the emphasis for us is that if a patient comes with it, we hope that they come in early enough so that we're able to catch cancer at an early stage.
Yes.
And if we are able to do that, we might be able to manage and achieve what is known as cure, right? Cure cancer, as it were. That means just eliminate the disease process. And once you've eliminated the disease process, we can follow you up and see that there's no return of the disease process. And that means you can continue living a normal life. Now, the problem is that if people are scared, some people might be scared, they have a lesion in the mouth like an ulcer. They don't want to be seen by the dentist. They might actually self-prescribe medications, thinking that it's an infection and hoping that it will go away. But the longer you stay at home, the worse it is. The cancer is not waiting.
Yes.
It's going to grow, invade the tissues, and it's going to try and spread. Because cancer, by definition, is able to detach, go to the blood vessels, or into the lymph nodes, or even into the chest, etc. So it's not going to wait for you as you're taking the medication. So the longer you wait, the worse it will become, and the harder it is to treat, which is what a lot of times we have been seeing in the past. And people staying a little bit too long, by the time they come to see us, the cancer has spread to such an extent that now it is difficult to eliminate all of it. So now you're going to be dealing more a very serious case where you're unable to achieve cure. So the cancer has spread, and now what do? You're just trying to make their life comfortable. And that's not where we clinicians want to be. So don't be scared. It's good to be seen. It's not that when you get a lump that it's a cancer. No, it could be anything, right? It's not that cancer is not at the head of the list. It's always there. It's towards the bottom end, but it's good to have them assessed. And once you get the reassurance, it's taken out and you get the reassurance that with this, even you yourself will be comfortable. So when it comes to what you're talking about screening, so you'll go to, let's imagine you go to the dentist or the clinician, as it were. They examine, then they notice something, right? So now there are certain areas. For example, if we see an ulcer on the lateral side of the tongue, there are areas where it occurs more commonly. So you see an ulcer on the lateral side of the tongue that is not healing. What happens, like for us as clinicians, we'll start developing what is known as a high index of suspicion. So we'll be looking, we're not saying it's cancer, we just say, this one is tending towards. We're not sure, right? So what we usually do, whether it's an ulcer or even a swelling in the neck, etc., the gold standard is to get that piece of tissue, whether it's a tongue or anything else, a swelling in the neck, etc., get a piece of it. And this can be done when you're awake. We call that a biopsy. It's not that you have to go and sleep in theater, in hospital. No, it's done awake. It's a minor procedure. Just inject a bit of local anesthesia so that you numb the place, get a small tissue, and take it to the laboratory. It is in the laboratory where they look and see the characteristics of those cells. Remember, for cancer, it is the cells that have changed. They've changed from being normal cells to being abnormal cells, and then they've got a certain characteristic. So when the lab looks and they find those characteristics, they will then write a report and then give us. That is called a tissue diagnosis. Right? We call it histopathology. It's a tissue diagnosis. So for us as clinicians, we can have a high index of suspicion.
Yeah.
But for true confirmation, that tissue must go to the laboratory for what? For examination under the microscope by a specialist.
Okay.
Now, once you get that back and it says, let's say it's cancer now, with that answer, then now depending on what you call the stage at which it is, you can now formulate a treatment plan for the patients. Right? That means for oral cancer, there are standard ways of treating it.
Yes.
Depending on how soon or how late you've presented to the clinic or to a clinician.
Yes. So Dr. Harry has mentioned about biopsy, which we believe is the gold standard of diagnosis. Is there any other type of investigation, or is there anything else you may request the patient to do, maybe imaging or something else that they may need to do so that they are just aware? Some patients may not be very open to biopsy initially, but are there any other forms of investigation other than biopsy?
All right. The gold standard is biopsy.
Gold,
yeah,
for sure.
If you want to see the extent of whatever it is happening, you can do a radiological study, what people call X-rays. Right? So there's special type of X-rays like a CT scan, computerized tomography. That will only tell you the extent of the lesion and give you again a suspicion that it might be a cancer. Right? The other things that people do in case somebody doesn't want to have a tissue biopsy, remember that tissue biopsy, that piece is the gold standard. But some people might decide to take a brush of the superficial cells, a brush biopsy. It's not the gold standard, but it can still be done. And then in some other areas, they also do something called toluidine staining. If they change the normal cell and a normal area and an area which looks like it's tending towards cancer, take up that stain differently. So it can lead you towards this might be a cancer. So there are those, but we don't consider those because those ones will still inevitably lead you to what?
To taking a biopsy.
Convincing the patient, please let's take this tissue and confirm it.
Yeah.
Because these other ones are showing you there's something very suspicious. At the end of the day, you'll have to take that tissue to the lab. The sooner,
the better. Okay. And people, we need these biopsies to be done by the relevant authorities. I think we had a discussion about maxillofacial surgeons, about clinicians, dentists. So you need to make sure that where you have gone to seek healthcare, you're being treated by the relevant specialties so that you can get the best quality of care. So a biopsy is not something to be scared of, as Doc has clearly pointed out. It's just a small bit of the tissue that is being taken. Very small. Sometimes you may not even think that it is going to be helpful. You know, some patients think, I think I had a patient once who had a lesion on the tongue and they thought we wanted to cut out the whole tongue. Yeah. So maybe those are some of the things that make the patients a bit scared, but it's not that. It's not what people may be depicting out there. It's just a really small piece that is being taken.
Yes.
So, are there specific people who we are targeting for screening?
Oh yes, now who do we target?
Yes, who are we targeting?
I think the best would be just to do en masse. So just tell, look, when you're doing your medical dental checkup, it's en masse. It's the best way. But of course, you'd be more keen to the people who have got modifiable risk factors. Like for me, if I have somebody who's taking alcohol, smoking a lot, a little bit elderly, might be want to be checking them a bit more carefully. If I've got somebody who has a history of cancer, even that tells you maybe there's a genetic factor there. Maybe a bit more careful. If there are people who are, better like you, those are notorious for causing these issues, be a bit more careful in following up those people. So you have to, whenever you're talking to a patient, you're not only focusing on that, you're also focusing on their lifestyle.
Yes.
So there are some specific questions that the doctor might ask you. You might find irrelevant, but they're relevant to what the clinician is thinking is the problem. Right? So that's how I would put it. But for me, I think en masse, you just go for your medical and dental checkup and then have your screening done at the center. It's a quick look. It'll take you 5 to 10 minutes.
Yeah.
And you'll be good to go.
Yes.
We're not saying that you'll find something.
Yeah.
So be relaxed.
Just screening.
So for me, I just say en masse would be probably the best way to do it.
Yeah.
Whenever you're doing your general checkup.
Okay. All right. So we've had a discussion around, who needs to be screened, and I think Dr. Kamau has put it very, very nicely that everyone actually needs to be screened. However, if you have this, maybe risk factors, you remember we talked about it in part 1. If you'd like to refer, you can go back to our previous video. We always said your healthcare provider is not seeking to judge you or anything. Please feel free to mention, when they ask, do you smoke? We are not there to condemn, yeah? But it's good that you mention this to your healthcare provider so that they have a better understanding of the situation you're in. To Feature, I know maybe in the African society, some things seem out of norm and very abnormal. But these are things that are important to mention to your healthcare provider. I think a thing also with the lesions in the head and neck region, some areas in the country, people think it's it's like a curse, yeah, but it's not. This is actually an illness. So it's something that we need to put out there, that these things can be managed. So it's not a curse, and it's not a taboo to mention these things to your healthcare provider. Now, we're going to go right ahead into this very interesting part of the discussion, management of oral cancers. First, you said cure cancer if it's found early. Why did we say cure?
Yeah, it was cure.
Yes.
It was kind of curative.
Yeah.
So like we were saying, and that's the importance of screening, and particularly early screening. If you get a small lesion that is in the oral cavity that has started maybe 3-4 weeks, really hasn't gone far, and then you check it, take it for tissue biopsy, the suspicion, which is confirmed to be cancer, that is early stage.
Yes.
It is very small, and there's a way we classify them in terms of the tumor size, whether your lymph nodes have been affected, and whether the rest of the body systems have been affected.
So the surgeon will do that.
They'll do an assessment, and that's what you call the staging of cancer.
Yes.
So usually for small tumors, that would probably be tending towards an early stage, stage 1. So in that sense, you can be able to actually remove that lesion in total, still take it for confirmation, but now when you've removed it in total, you're self-confident that you've removed most, if not all, the lesion. You'll do the clinical assessment. Obviously, remember when this tumor is starting, the way oral cancers progress is that they increase in size, they destroy the tissues, the blood vessels, the nerves that you see, then now you'll find they start now migrating either to the lymph nodes at a later time, all right?
Yes.
Usually, and then maybe further, they can go through the blood system maybe too. So usually all this is a step process, so it takes time for this to occur. So if you cut it early, you probably won't have moved to where it has gone to the neck or to any other place. Obviously, you'll be assessed, but more often than not, as a clinician, after the assessment, you'll be confident that, yes, we most likely got all of it. You're confident probably because it was early stage, high likelihood that it has also not gone to the neck or anywhere else in the body. And that's when we can now, with monitoring over the years, we can be confident that the likelihood of you achieving cure is high. And that's why you have this what we call 5-year survival.
Okay.
The earlier it's caught improves your survival over 5 years. Right? Okay. So if you catch it early, you 90-something% will be still there in 5 years. If you catch it late, where the tumor has grown and festered over months, there are lymph nodes which are swollen, maybe you have a cough and there's something found in the chest. Now those are the difficult ones. Your survival is no longer even being looked at in 5 years. Once you have something in the neck, your survival rate reduces by 50%.
So the earlier, the better.
So once it has spread,
I
mean, we're not even thinking about 5-year survival. For you, we're thinking less. And then trying to get it all out is very, very difficult. So that's why screening is very, very important. So that if you catch it early. And if you catch it early, there's a high chance of what? Of the tissue being removed completely, the assessments being clean, and you being what? Being termed as cured, right? But remember, because you had got the cancer initially, there could be a chance that you can't get it again. So follow-up will always be essential. But your chances of you living a normal life increase dramatically.
So these lesions, the cancerous areas, they have to be removed, or we say excised, yeah?
Yes.
So they have to be removed. Is there any sort of medication that these patients can be given other than excision? Because there's been a lot of talk about, I took this and this medicine and then the cancer went away.
All right. Now for oral squamous cell carcinoma, usually the gold standard, we keep mentioning this, will be to do the surgery, just to remove it.
Yes.
Now, depending on where the cancer is, usually for treatment of cancer, for you to try and get it all out, there's something called multimodal therapy. So you can have surgery being done. You can also have radiotherapy being done. So I know people have heard of radiotherapy. And then there's that one what you mentioned, medications, chemotherapy. So chemotherapy is something that you take. It's a systemic, it's a drug that will act within the whole system and possibly get those small spreads, metastasis to other areas and wipe them out, right? If you catch it very early, surgery alone, you can be confident that maybe surgery alone is enough.
Yes.
And you leave these other tools in case it relapses in the future. You can leave these other tools to come in. But if you get it a little bit later where you have the tumor in there, maybe in the mouth, then you also find some lesions maybe in the neck. Then now you have to combine treatments, right? So now you have to do surgery to remove the mass, the tongue, and also those in the neck. And then now do radiotherapy to also now clean the area of others that you cannot see. That's radiotherapy. You may or may not add what? Chemotherapy. Because usually that one can be very challenging to the patients.
Yes.
These are very toxic medications you're giving, and even radiotherapy is very hard on the patient. So you also have to look at the general status of the patient. So chemotherapy, because now it's in the neck, you're not sure where it is in the body. You will limit chemotherapy to giving somebody who you suspect maybe there are micro spreads in the rest of the body, so you can add chemotherapy. All you're trying to do is ensure that you have hoped that you have killed all the cells, removed the tumor, and whichever cells are around, you have also killed those tumor cells, right? And then now you're tending towards trying to achieve that cure. But remember, you'll do this multimodal treatment if the tumor or the cancer is a bit more advanced, which would be assessed by a clinician. More advanced means what? You probably stayed a little bit longer before seeking treatment for whatever reason.
There are many studies that are saying that the survival rate with regards to oral cancer in Kenya is super, super low. Why is that so?
The time when you reach, and also the area. You can imagine one tumor that is on the lip, or one tumor that's far back in the throat.
Yes.
The area of the head and neck is an area where there's a lot of important structures.
Yeah.
And remember, when you're trying for a tumor, when you're trying to get it, you'll try and get the tumor itself and no more tissue around. So it's very destructive. So the area also is very important, and the size, like I told you, the size. If you catch it early, you're able to get all of it without really injuring a lot of tissues. But the larger it is, and if it's in a more precarious position, let's say in the throat there where there are a lot of structures, blood vessels, etc., you may not actually be able to get all of it out. And so because of this area of complex anatomy, if you get a cancer in that area, which is advanced, the outcomes tend to be poorer. But also we noted that there are poorer survival rates, more or less in general, because of late presentations. People come late because you find that the patients, maybe, I wouldn't say lack of education, maybe they get a lesion they don't suspect, or they go to alternative medicine, people who maybe give them herbs thinking it's an infection or whatever it is, and they stay a bit too long. And if they stay a bit too long, they are then going to the health facility when the tumor is already too far removed or the cancer is too far removed. So what happens? Obviously, the outcome will be poorer, right? But in general, you can't chop off the neck. If you have a tumor, let's say on the lower limb, you can do an amputation.
Yeah, we can chop off the yes.
But in the face, you can't just chop it off, and you can't, exactly. So it's the area of complex anatomy that also contributes to this. When you get a lesion and it's in a tough area, getting it all out is also a bit difficult.
Yeah.
So now what does that mean? That means also your outcomes tend to be a bit poorer.
It's poorer.
So where it is matters. If it's on the lip, you can actually see it and remove and reconstruct. That's good.
Yeah.
But if it's at the throat,
it's difficult. The head and neck is complex.
It's a complex area.
Yeah.
So that's why assessments must be done. You might have something at the back of the throat you don't know about. So always go and have a check.
Yeah.
Even if it's caught early, even if it's at the back of the throat, it can be removed. But if it grows big,
it becomes a challenge.
Exactly.
how accessible is radiotherapy and chemotherapy in Kenya? Let's say just for the common mwananchi, are they able to get radiotherapy and chemotherapy?
Yeah, you see another thing that you're talking about, it's like having a car but without a driver. You also have to have the medical expertise for the people to do the radiotherapy and the chemotherapy.
Yes.
You have to have people who are competent to give you the medications, all right? So chemotherapy will be dependent on medical, we call them medical oncologists.
Yes.
So cancer specialists. So the availability, are they there? Yes, they're there. But again, they're not so common. So it's the availability of them. Radiotherapy will need complex equipment and also people competent, the doctors, radio oncologists, to run to be able to treat you. So yes, there's an improvement. The machines themselves are very expensive. So you'll only find them in high-end either hospitals or in tertiary public hospitals, unfortunately. So sometimes they may not be very accessible. And that would mean that there's probably also a waiting list. Because cancer doesn't wait, but again, the machine is maybe, they're not many. So you find a long waiting list, which impacts on what? On your outcomes. So there's definitely been an one of the pillars is treatment of cancer for one of our health pillars. So there's been a push towards getting all the equipment necessary so that people can access it, especially in the rural settings. So we're getting there, is what I'd say. But we're trying to get there.
But we are far.
We're far because you need the specialists and the equipment, whether it's the medications, whether it's the radiotherapy machines, the expertise. And this impacts on survival, whether it's oral cancer or any other cancer. So those are challenges that people know that are trying to overcome. That's
Yes. All right. So we are hoping we are going to get better in Kenya, maybe over time. But we have to push for change. We have to be the people who are pushing for change. Maybe lastly, we can discuss what we think is, globally, this month of April is basically Oral Cancer Awareness and Screening Month. Is there anything that we are doing in Kenya to raise awareness of oral cancer, or is there anything we can do better to raise awareness of oral cancer? Okay,
I'm not sure about the policy level, but I think one of the things that we're trying to do is what you're doing right now.
To educate.
To educate.
Yes.
So it starts with the clinician to educate. Remember, the focus would be on the bigger things, of things, the bigger cancers, etc. But oral cancer is something that affects you. You're not a statistic, it's one of one. Right? So it's up to us as clinicians to do it, just the same way you're doing for this program. So this is part of the awareness. So the good thing is now we're having the medical practitioners themselves bringing out the awareness, no longer being curative only, but trying to be also, should I say, preventative, trying to be proactive, not reactive. And so your awareness is also contributing, and there are also other awareness. In terms of policy, to be honest, I'm not too sure about oral cancer. I have not seen, but I am, should I say what? Maybe they can check. I'm not sure, to be honest.
We don't know if there's anything really, because I've seen Kenya Cancer Society and the National Cancer Survey. I mean, the bigger organizations that deal with cancer. There's not a lot about oral health being done. So maybe we by raising awareness, we are hoping that also these institutions that help us to push this awareness and to do screening, that they can pick this up and we can do better with regards to oral health and oral cancer. This was quite an informative discussion. Thank you so much, Dr. Kamau, for joining us. Guys, we've had a specialist on our channel and he has basically enlightened us on oral cancer. We're super, super grateful for the talk that we've had. We're hoping it's going to make a difference and someone somewhere is going to be making a better decision to go for checkup, to have screening done, so that we can catch these things early. Thank you guys for joining us on this episode. Thank you for following us on our series. And let's keep making better decisions and keep making oral health in Kenya better. We'll see you again on the next episode of My Oral Health Diaries.